My name is Susan Flaker. I am the Regional Pharmacy Director for Mayo Clinic Health Systems in Rochester, Minnesota. So I started school at the St. Louis College of Pharmacy, which is now the University of Health Sciences in St. Louis, Missouri, because they have expanded from just a pharmacy program. And I went there and I got all my schooling. And while I was there, I also worked at Barnes-Jewish Hospital. And once I graduated, I did actually look into a residency, but decided I didn't want to do one. And I went into just staffing at Barnes, but shortly after got a supervisor position at Barnes and just got into leadership that way and went on to get my MBA at Webster University in St. Louis, Missouri as well. And just took as much opportunity to learn as much as I can. And I recently completed the DPLA, or the Leadership Academy, the Pharmacy Leadership Academy through ASHP. So I started my pharmacy career actually when I was 15 and a half. A family I was very good friends with owned a local independent pharmacy in my hometown of Columbia, Missouri. And I got a job there working in the front register. And my father is a physician, and I always loved the idea of medicine, but I didn't think I could be a doctor. And so I just saw the impact that at a local independent pharmacy that my family friend had on the patients, and how people got to know him so incredibly well, and he got to know and take care of them. And that really inspired me. So when I entered pharmacy school, my intent had been to go back home and work at this local independent. But then after I got a job in a large hospital, I just fell in love with, honestly, the rules and regulations and everything that goes into taking care of the patients in a large hospital, and how you get to do a lot more clinical work than than perceived to do in a retail setting. So I decided that I would stay in the hospital setting, and just got involved that way, and really liked leadership because I liked coming up with processes and how to do things. So I actually cover the 5 sites around Mayo Clinic Health System in Rochester. So I'll go to Austin, Albert Lee, Cannon Falls, Lake City, or Red Wing. And those are small and rural community hospitals. So I work very, very closely with not only the administration, but the pharmacy team. The best part about my day is I walk through the pharmacy every single morning, and I get to talk to my staff directly and make that connection with them. And we talk about the problems that they're having or what we could be doing to improve the system. And normally, if they're having some kind of problem, that's going to take priority of my day because I want to help them. But if not, then I'm looking at processes and workflows, or I'm talking to administrators on how we can fix larger level problems or get resources that pharmacy might need. Oh my goodness, the favorite part of my day. Well, I love talking to my staff and I love talking to people. So that is a fantastic part of the day. But I'm going to change the question a little bit and ask and say what the favorite part of my job is. And I get to look at problems and solve the problems and figure out what the answer to the problem is. I like looking at problems because I look at them out of the box, and I try and look at them from multiple different angles. So if we want to, for example, I'm working very closely with the AI initiative for Mayo Clinic Pharmacy, and looking at how we can use artificial intelligence to help grow and strengthen our workforce, to give them more ability to practice how they want to practice and not work on tedious day-to-day things. So figuring out the how to do that and building it and looking at it from different angles to make sure that it works. And so if I'm not talking to people, if I get a chance to sit there and look at those problems and think about them and how to make them work and how to make things function better and prioritize different tasks for people, that's an amazing part of my day, because once you figure out what that problem is or how to address the problem, it just kind of opens up and it's easy to solve, and you get that sense of accomplishment. So the favorite part of my day is whenever I get to work on different problems that come up. When I'm working on different problems, I like to look at them from multiple different angles. One of the things that I do with Mayo Clinic is I help out with the AI initiative, or artificial intelligence initiative, for pharmacy. And I really get to look at things from a different angle and figure out how everyone is trying to answer different questions or solve different problems, look at it from different angles. And then once you find the solution and help open it up, that just becomes an amazing thing. So how can we use artificial intelligence, or how can we use different predictive models to help alleviate some of the burden on the staff so the staff can focus on more of the clinical things? So trying to look at those higher level things to solve problems for the staff is one of my favorite things to do. I think that the most important thing to do, first of all, with pharmacy, there are so many different parts of pharmacy and so many different facets. So try and explore everything. Don't focus on a single area and say, this is what I'm going to do. Really explore the different areas and find what you love. because once you find what you love, then you'll really hit your stride. You might be overly clinical and you want to work with the patients on that clinical realm. And that is fantastic if that's what you want to do. But if you're more business minded, maybe you want to become a pharmacy leader and go into that way. I think just try and be open-minded to everything and don't fall under the stereotype that a pharmacist is this. Really try different parts of pharmacy and see what the part of pharmacy is that you love.